to make sure.
Hello and welcome into this week's edition of AFMC TV. I'm your host, Michelle Rupp. Hannah Windley joins me now. And Hannah, you work here at AFMC.
Yes, ma'am.
And so we are talking about a program that AFMC is proud to be a part of, Arkansas Good Medicine.
Yes, ma'am. The AGM program is funded by the U.S. Department of the Health Resource Services Administration through a grant we have here at AFMC. And so far, this is our fourth year of the grant, and we've had 13 fellows graduate through our program. So we're currently in the process of recruiting for our fourth cohort.
So tell me about this program. Somebody who may be watching that this is the first time they're hearing about Arkansas Good Medicine, and it's a fellowship and a cohort. Like, what does it mean? What all do you do?
So with the Arkansas Good Medicine program, we train physicians on things such as trauma-informed care, adverse childhood experiences, social determinants of health, population health, and we also touch on things like leadership and quality improvement, as well as providing our fellows with a 9-month opportunity to actually implement a healthcare transformation project within their own clinic so that they can have a real impact, not just within their clinic, but within their community as a whole.
Okay. So you're teaching them.
Yes, ma'am.
Okay. And it's physicians that are already in practice. So you're not necessarily looking for medical school residents or anything like that.
That's correct. Our requirements do state that our providers have to have been practicing for at least 2 years with a MD, a DO, or a PA license. At this time, we're hoping in the future to be able to expand that to APRNs and nurse practitioners, especially since Arkansas is so rural. We want to be able to open it up to every provider to give them the opportunity to learn and to be able to just have the opportunity to do something larger than themselves and even larger than their clinic through the healthcare transformation projects.
How long does this program run?
So every cohort lasts 1 year, typically from March to February. And the first 12 weeks of the program are strictly curriculum based, and everything is done online. So our fellows can be from anywhere, not just in the state, but we also accept fellows or providers from anywhere in the country. Okay. So it makes it very easy for them to be able to do the online learning program, and then their 9-month transformation project is done within their own clinic. So they never actually have to travel here to Little Rock.
Okay. It sounds like it's very user-friendly.
Yes, we're trying to make it that way as much as possible, especially with everything going on with the current pandemic. Mm-hmm. We know healthcare providers are busy. Yes. So we're trying to make it easy for them, but we also want it to be a very rigorous learning opportunity and a way for them to have a very positive impact within their community.
You mentioned this is the fourth cohort that you're recruiting for.
Yes.
Is there a magic number? How many providers that you accept into the program?
At this time, we're hoping for 7 fellows for the cohort to start in March of 2022.
Okay.
So
it's exciting.
Yes, we're in the process of recruiting with our 2 partners, the Arkansas College of Osteopathic Medicine, ARCOM, and ARCare, which is a FQHC here in Arkansas.
Okay. So if someone is interested, is there a website that we can direct them to? How can they either get more information or fill out an application for consideration?
Of course, yes. We have the Arkansas Good Medicine website, which is www.afmc.org/AGM. Okay. It has all of the information on it. It has a spot where you can even ask questions and we'll get back to you. And as well as, of course, the application is on there. Our application process runs from now through January 28th of 2022.
Okay, so you've got from now, early, mid-December,
yes,
until January.
Yes.
Okay, fantastic. And then when will notifications be made?
We're hoping to have notifications out in probably no later than the second week of February, because we'll have a kickoff meeting, virtual, of course, at the very end of February. And then their curriculum phase will start on March 13th. So as long as everything goes well,
Yeah.
we'll be starting right on time in March.
Fantastic, which is right around the corner.
Yes, it'll come very quickly.
Very quickly, yes. Hannah, thank you for coming in today.
Of course. Thank you for having me.
Joining us now is Angie Walker from DeQueen. Angie, you are with Dr. Walker's Family Practice in DeQueen, and we've got a real interesting topic. I'm excited to kind of dive in to this topic with you today. Social determinants of health. And we're even going to kind of put a spin on it because Christmas parties and holidays and family get-togethers are going to be coming up that could really be triggering for some. So let's start from the beginning and let's talk about just what are we talking about when we say the phrase social determinants of health? What does that mean?
So it's a barrier to your health. It can be lack of transportation, food insecurities, housing insecurities, utility issues, anything that puts a barrier between you and a healthy lifestyle.
Now, can that happen at any age, or are we specifically talking about children and adolescents?
So it can happen at any age. What studies have shown is that when it impacts you at a childhood level, it seems to affect you throughout your lifetime. And so, you want to try to be the bridge during that childhood time period so that it doesn't go on later into life.
So children who have experienced these barriers, how does that manifest in them? What might we see in like a classroom setting, for example?
So, if you're hungry, you can't concentrate.
Yeah.
If you don't have utilities, how are you doing your homework?
Yep.
If you don't have transportation, how are your parents getting you back and forth to doctor's appointments, dental appointments?
Yeah.
If you don't have housing and you're living, from relative to relative to relative, that's distraction for a child.
Yeah. And that's going to come out in a bunch of different ways.
Yes.
Maybe fighting on the playground, maybe some arguments in the classroom, acting out.
Poor grades. You can't concentrate because you're hungry. You can't get your work done because you're tired.
Yeah.
So,
okay. So if someone's watching this, and they're starting to kind of connect some dots, and they're thinking either, oh my gosh, she's talking about what I've experienced, or I've got a child that is starting to, a child that I'm teaching that is starting to fit some of these patterns. What do you do?
So and I'll just kind of tell you what we focus on in our office. We try to make sure we're screening our patients, and that's at any age. We do an in-office food bank. We do offer transportation to our patients as well. So anything where we can bridge a gap, the same thing's true for the school districts. A lot of them have the backpack program. Mm-hmm. They also have extra school clothes and things like that. They have a clothes closet. And so, a lot of people that are interacting with children are already trying to bridge those gaps. One of the things that we worry about during the holiday period is you're out of school. Yeah. So you don't have access to the backpack program or to those clothing, assistance and stuff like that. And so that's always a scary time for us, is the time period when school's out. And so in our office, we try to really focus on children during that time period, making sure that even though you're not here for a wellness visit, we're still going to screen and make sure you've got food at the house. We're going to make sure that you've got utilities, that your utilities are on, because we're getting into, it's cold. Mm-hmm. That's a big deal. And so I think, now more than ever, as you get towards the holidays, but also those holidays fall within colder months, mm-hmm. you're more hypersensitive to it.
What goes into that screening?
So with our office, it's going to be about a series of 10 to 15 questions, and it's just part of that whole overall wellness visit. We're asking if you have worries today about food. Are your utilities on? Do you have transportation? Do you have a church family? Because a lot of times, even church bridges that gap for you as far as transportation and food, and a lot of their drive-through food programs and so a lot of those. And so it's about 10 to 15 questions that, they're not overt. They're just, as you're chatting, you're asking. And then my group knows how to look at that screener on the other end of it where, she just said that, she's a little worried about food in the home. And so we don't make a big deal out of it. We just make sure that we have a basket of food that we bring into that room and that patient leaves with that day. As a physician's office, we do a resource guide, and that resource guide makes sure it hits every social determinant of health, also childcare services and those kinds of things, so that if the patient, what we call pops positive for one of those social determinants, we're going to make sure they have that resource guide in front of them. It's going to help them make decisions about utilities, housing, any of those things that could be a barrier.
What about success stories? Do you see many of those, or which ones do you see? Talk a little bit about that.
So we've had a couple in our office that we're super proud of. We had a diabetic patient that could not get a number under control, and the nurse actually thought, well, I'm gonna do this screener. And when she was talking to the patient, identified the patient didn't have a refrigerator. So it's very hard to keep that medication stable if it's not refrigerated. And so she was able to engage a couple of other resources that we had, and then even the insurance carrier, to make sure the patient had a refrigerator. We had another patient that did not have running water. They had it at one time, but then something broke and they weren't able to get it fixed. And this one just happened to be one of the Medicare Advantage programs, and we were able to get a hold of them, and they sent someone out to repair that. And so, there's a lot of resources out there that can help you battle those social determinants of health, but you really don't understand that until you start asking about them and screening for them. And if you're going to screen for them, make sure you have a resolution or you have something, because just knowing is not enough. Once you have that information, it sets on you, and you've got to do something about it.
Yeah,
so.
It's not oh wow, okay, sorry.
Yeah.
No, that's right. It's got to be action.
Act.
Exactly. What about resilience? Does resilience play in on this?
I say absolutely. I mean, the mankind is resilient. You have those individuals that, social determinants of health don't impact them. They kind of spark them, move them forward, and they get past those things. It's just, you're just resilient to it. But I think sometimes too, you don't realize that as you move into adulthood, it does play a factor for you. It does play into how you live your life. Suddenly you're doing things and you don't remember why you're doing them. And then you're like, oh, that impacted me at a younger age. And so yeah.
What might be some takeaways, because we are just a few weeks ahead of Christmas, and for many people this is a wonderful, joyous time. For many people this is a very difficult time, and so what are some takeaways that we can be mindful of, and maybe kind of easing that, because, and I keep going back to the child in the classroom. Other kids are talking about their Christmas list and what they're, what they hope they're getting or what they think they're getting. And then there's at least that one child in the classroom that's thinking,
I hope I have electricity.
Yeah.
I think, some takeaways are, number one, be kind. We're all suffering. Everyone's tired. Everyone's had a rough 2 years. We can start to see the other end of that. Number two, one of the things we try to do is try to involve ourselves in as many of those projects that are going on that we can. Toys for Tots. There's a lot of stuff going on in the school districts as far as, they're getting ready to stuff those backpacks for 2 weeks. They want to make sure that those kids have some kind of a meal that they can cook for themselves over that time period. Reach out to those school food banks. You can reach out to those school clothes closets. So there's a ton of stuff. Your local church, your churches and your school districts are going to know a family in need. If they don't know a family in need, a lot of times you can talk to your physician's office, and while they can't provide you with a person's name, they can certainly, hey, if you can drop off this, and this, I'll make sure it gets to this patient. And so they can bridge that gap as well. And so that's one thing that we do is we're moving into the holidays. We're not thinking about gifts and those kinds of things. We're trying to make sure we're meeting just basic needs, because we do know that there's a population that is not getting a basic need met. And so how can we, take what we were going to spend on Christmas and partying and all that stuff, and how can we make sure basic needs are getting met? So.
That's good. That's real good. All right. Angie Walker, thank you so much. Came up from DeQueen today. We love having you here in the studio. It's been a good time. Thank you. And thank you for joining us. We'll see you back here next week for more AFMC TV.